Jeff, what is the role of alcohol and drug use, and what do you tell your patients about that?
Well, if I have a patient who is depressed in any way, I tell them that alcohol and drugs could have caused it, or it can interfere with the medications helping to treat that depression. And one of the ways that will distinguish whether or not alcohol or drugs caused the depression, which they can do, is to get a good history and to see what started first. If the depression in the person existed in their life before they were using alcohol and drugs, then they may have a primary depression problem. And the alcohol and drugs, of course, can make it much worse. If the depression started in their lives after they were using alcohol or drugs, then that might have been caused by the alcohol and drugs.
And I think regardless of whether it was caused by the alcohol or drugs, it's important for patients to understand that alcohol is a depressant. And so if they're being treated for depression, it doesn't make sense to continue using alcohol, right, because it will only make their depression worse.
Right. And you know, a corollary of this is a lot of times patients don't realize it's not alcohol or drugs, but it has to do with medicines. A lot of times people are taking medicines for all kinds of medical conditions that can have side effects of causing depression. So one of the things you have to consider if somebody comes in with a significant depression is, are the medications causing it? Because that needs to be corrected just as a medical condition needs to be corrected as much as possible.
Absolutely.
Yeah.